Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. The topic for this episode is comparison of medication adherence assessment tools to identify glaucoma medication non-adherence. I'd like to thank our host, Gretchyn Bailey, our topical editor, Dr. Andrew Rixon, and our topical expert, Dr. Joe Sowka. And now it's my pleasure to bring you today's podcast.
Hi, everyone. I am Gretchyn Bailey, and I am a fellow of the American Academy of Optometry, and I am joined by Joe Sowka, who is also a fellow of the Academy, an optometric clinical provider at Center for Sight in Sarasota and Venice, Florida. Hi, Joe. Thanks so much for talking with me.
It's great to catch up with you, Gretchyn. I'm happy to be here, and it was great to be here. It was great to be anywhere. So I'm looking forward to discussing a few of these hot topics with you.
Absolutely. Well, let's jump in. We're going to be talking about the comparison of medication adherence assessment tools to identify glaucoma medication non-adherence by Cho and colleagues in the May 2022 issue of Ophthalmology Glaucoma. So this study aimed to determine the accuracy of 5 subjective self-assessment tools to monitor medication adherence in patients with glaucoma. What did the study results show us?
Well, this was a study that actually was trying to look at people who are already self-identified and recognized as being non-adherent, meaning that they use their medicines less than 80% of the time. And there were some self-assessments in questionnaire, and they had made comparisons with electronic monitoring devices where the medicines were put into a special bottle, and also comparing against pharmacy records where the researchers would actually call the pharmacy with permission to find out when the medicine was dispensed, how much it was dispensed, how often it was dispensed. And they tried to, of course, compare to the gold standard. The gold standard was the monitoring device. Now, what they found was it was very simple. One question was best at identifying those people who were non-adherent, meaning that they were 80% or less adherence throughout the 3 months that were studied, and that was just simply asking them, open-ended, over the past month, what percentage of your medication do you think you used correctly? And people who answered that correlated very well with the medication monitoring device. Now, there are some limitations in there. Medication monitoring device they use only determine if the medicine was opened and closed during a specified period of time. And the data from the pharmacy was actually not really well correlated with anything. In fact, it was poorly correlated with identifying those who actually were non-adherent. So it comes down to really one simple question, and it is very easy to do in clinical practice. And the monitoring device that they use, had an annual cost of over $1,200. So that's not practical. And calling the pharmacies, and that could be plural, was very, very time consuming, not very cost effective. So identifying those patients who are non-adherent is pretty simple if you ask them in an open-ended manner.
That's really interesting that just one open-ended question, when there's been so much conversation around how to keep patients more adherent with their medications, just one question.
Yeah, one question to find out if they're not adherent, and it's not a judgmental question either. It does encourage some honesty. And if we identify those who are non-adherent, we can identify those who might need more invasive therapy, surgery, laser, or implantable devices that takes adherence out of it. And we can also give them some support to try to get them more adherent, because next time they come in, we can ask the same question again. What percentage of time do you feel you use your medicine correctly? And if the number is going up, then our activities have been effective. But everything else that we look at in terms of pharmacy data, monitoring devices, they're really not practical for clinical practice.
Do you ask your patients that open-ended question?
I probably do not do it often enough. And I think a benefit to me in doing the series here is I am now aware to ask it a little bit more often. I always ask patients in some non-threatening way and not with a yes or no answer. How are you doing? And sometimes I'll do a little bit. I'll trick them. I'll say, now you're using the medicine twice a day in your right eye only, correct? And if they correct me because I say it wrong, that tells me that they are involved and understand what they're supposed to be doing. But I think just the simple question, over the last month, what percentage of time do you think you use your drops properly? Very simple.
So why do you think the results of this study are important to optometrists?
It's important to identify, not just assume that patients are doing everything we ask them to do without question, because many do not. And some are a little hesitant to report that they may not have been adherent, or they feel badly about it, that we're going to be angry with them. So we have to do this in as non-judgmental manner as possible.
Right. Well, this was some great information to share with fellow optometric colleagues. Joe, thank you so much for talking with me about this today.
Great to speak with you, Gretchyn.
And a special thanks to Cooper Vision for their educational grant to make it all happen.